Now in our third section, let's talk about thyroid hormone disorders. And in this, we will talk mainly about two disorders. One is by the decreased production of thyroid hormone, which is hypothyroidism, and then another is by increased production of thyroid hormone, which is hyperthyroidism. Hypothyroidism. This is the thyroid gland present in the neck. Here in front of the neck, there is the thyroid gland. Hypothyroidism is due to decreased production of thyroid hormone by the thyroid gland. Thyroid hormone is very important for metabolism. So metabolism is performed or done by the thyroid hormone. When there is decreased level of thyroid or hypothyroidism, all the features, signs and symptoms that patient present with is mainly because of decreased metabolism, which occur as a result of decreased thyroid hormone production. Similarly, hyperthyroidism will be all the signs and symptoms associated with increased metabolism of the body. So hypothyroidism or decreased thyroid hormone is an autoimmune diseases that can cause hypothyroidism. Autoantibodies like thyroid peroxidase, Hashimoto's disease leads to gland destruction and fibrosis. And as a result of gland destruction and fibrosis, there is hypothyroidism or decreased thyroid production. So it is autoimmune, in which there are autoantibodies that causes destruction of the thyroid gland. It can be iatrogenic, self-induced also as a result of thyroidectomy. When the surgery is performed and thyroid is removed, it is thyroidectomy, and after the thyroidectomy, there is hypothyroidism. It can be also due to radioiodine ablation or excessive dose of anti-thyroid drugs. So it can be iatrogenic by the removal of thyroid, by radioiodine ablation or excessive dose of anti-thyroid drugs. Next, what are the implications of decreased thyroid on pregnancy? How does hypothyroidism affect the mother and the baby? As I said, thyroid hormone is mainly responsible for metabolism. So it affects the overall growth and development of the baby. Can lead to miscarriage, leads to low birth weight pregnancies. It can cause anemia because of poor metabolism, and it can cause high blood pressure in pregnancy. So all these can occur during the pregnancy as a result of hypothyroidism. Management of hypothyroidism is thyroid functioning test is performed every trimester to find out what's the normal, if the normal level of thyroxine is present, and then the test usually performed for the diagnosis of thyroid levels is TSH level. TSH is the thyroid stimulating hormone produced by the pituitary gland, and that's the best indicator of thyroid hormone level. If the thyroid hormone level is high, the thyroxine TSH level is low. If the thyroid level is low, TSH level is high. This is the negative feedback. One is high, other is low. Though TSH is the indicator of thyroid level. Then therapy should be adjusted. The levels should be within the normal range for the proper growth of the baby and the fetus. Iodine deficiency can also lead to thyroid hormone deficiency. Iodine is the hormone, iodine is required for the production of thyroid hormone. So if there is deficiency of iodine, it also can lead to hypothyroidism. Next, hyperthyroidism in pregnancy. If the thyroid levels are high, this is the anterior pituitary gland. Anterior pituitary produces the hormone known as thyroid stimulating hormone. This thyroid stimulating hormone acts on the thyroid, and this produces the T3 and T4, which are the thyroxine thyroid hormones, and they act on the pituitary gland and controls the level of thyroid stimulating hormone. So normally not present in healthy women, this normal, the hyperthyroidism in Graves' disease, there is thyroid stimulating antibody activate the thyroid stimulating hormone receptor to cause hyperthyroidism. And then this thyroid stimulating antibody pass the placenta and can cause fetal and neonatal Graves' disease. So even in pregnancy, there is hyperthyroidism because of increased thyroid stimulating A and B cells antibodies, thyroid stimulating antibodies. These thyroid stimulating antibodies activate or stimulate the receptors, TSH receptors, and cause hyperthyroidism in the mother and the of the placenta, can cause fetal and neonatal Graves' disease. Now, normally hyperthyroidism here normal in the what happens is thyroid stimulating hormone stimulate the thyroid to produce thyroid hormone T3 and T4. Serum concentration of TSH are slightly less than the reference range for non-pregnant women, especially in the first trimester, due to stimulatory effect of HCG on the thyroid gland. TSH secretion is suppressed because of negative feedback effect of raised circulating thyroid hormone concentrations. As I mentioned, TSH levels are regulated by the level of T3 and T4 or thyroid hormone level in the blood. If it's low, TSH is raised. If it's high, TSH is low because it is controlled by the negative feedback effect. So hyperthyroidism in pregnancy is due to the effect of also HCG on the thyroid gland. HCG is the hormone, human chorionic gonadotropin, that is produced during the pregnancy. So it has effect on the thyroid gland and causes increase in the level of the thyroid hormone. So gestational hyperthyroidism is seen in women with very high HCG concentration during normal pregnancy or in more pathological states like molar pregnancy or choriocarcinoma. In Graves' disease, HCG stimulation of TSH receptors is overshadowed by the stimulatory effect of TSAB. So again, hyperthyroidism in pregnancy is mainly due to the effect of HCG on the thyroid hormone. Implications of hyperthyroidism on the of pregnancy on disease. So what are the effects of the pregnancy on the disease? There is increased requirement of thyroxine, postpartum flares, thyroid crisis occur if it is untreated. So requirement of thyroxine is increased in pregnancy. There is flare-up of disease after the delivery, and thyroid crises occur if untreated. Heart failure can occur. Now, implications of disease on pregnancy, what can occur? Higher rates of preeclampsia because of increased level of increased hypertension or increased blood pressure. Fetal growth restriction, prematurity, stillbirths can also occur. Here again the same picture. This is the hypothalamus, and this is the thyroid gland. Thyroid, we have T4 levels, T3 level, which is the thyroid hormone. This has a negative effect on the pituitary and hypothalamus. Then we have thyrotropin releasing hormone act on the pituitary, thyroid stimulating hormone act on the thyroid gland. So but in the pregnancy again HCG has its effect also, and this can cause increased production of the thyroid hormone, which can lead to prematurity, stillbirth, fetal growth restriction, and high rate of preeclampsia. Thyrotoxicosis in fetus can also occur. Now the management is thyroid functioning test every 4 to 6 weeks. Therapy should be adjusted accordingly. Specialist advice regarding medicine use. Serial growth measurements. During the pregnancy, if there is thyroid disorder is present, usually endocrinologists are required to manage the dose and follow up the patient or the pregnant women. Serial growth measurements. Regular assessment of fetal heart rate. So all these managements are important. Assessment of fetal well-being for the growth, and fetal heart rate should be monitored regularly. Then we have thyroid storm. It's another condition. It's a state of medical emergency due to massive release of thyroid hormone. So excessive release of thyroid hormone, and it's a emergency situation. There is rare but serious complication of hyperthyroidism, known as thyrotoxic crisis. 3 to 5 times more common in females. There is risk is higher after trauma, surgery, heart failure, or severe distress. If patient have hyperthyroidism and they have all these complications, surgery, trauma, there is thyroid storm caused by untreated or undertreated hyperthyroidism. Symptoms are irregular heartbeat, high blood pressure, fever, GI distress, and confusion. Diagnosis is usually clinical. Treatment is by anti-thyroid drugs and radioactive iodine. Life-threatening in 20 to 50% of the cases. So it's life-threatening in 20 to 50% of the cases. So proper management of hyperthyroidism is important to avoid this thyroid storm. So that was all about the thyroid gland and hypothyroidism and hyperthyroidism. Thank you for watching sqadia.com.